Good day, I am Fernando Pascual, Patient 3F, and today I'll be performing the surgical hand washing procedure. The goal is to reduce the number of microorganisms on the hands, cross-contamination, and transmission of microbes and diseases. For the equipment, check for soap, running water, and paper towels. For the implementation, nails should be kept short because most agencies do not permit healthcare workers in direct contact with clients to have any form of artificial nails. Because short natural nails are less likely to harbor microorganisms, puncture gloves, or scratch clients. Next is the removal of all jewelries because microorganisms can lodge into jewelries and under rings. Then check for breaks in the skin such as hangnails or cuts because a nurse who has open sores may need to require a work assignment to decrease the risk of cross-contamination. Next, if you are washing your hands where the client can observe, you introduce yourself and explain to the client what you're about to do and why is it necessary. Next is to turn on the water and adjust the flow. There are 5 common types of faucet controls. We have handheld or operated handles. Next is the wheel levers. These are regulated with the use of our knees. Then next is the foot pedals where we press this with the foot to regulate the flow and the temperature of water. Next is the elbow control where the movement of our elbows are detected instead of our hands. And finally, the infrared control motion in front of the sensor causes water to start and stop flowing automatically. First, we will do a pre-scrub. This removes any excess dirt or contamination. Now, we wet our hands thoroughly by holding them under the running water and apply soap to the hands. Apply the soap and wash, but hold the hands higher than the elbows during this hand wash. This will let the water flow from the least contaminated to the most contaminated. If the soap is liquid, apply 4 to 5 ml or 1 teaspoon without touching the bottle. Use your elbows if necessary or have someone to operate the soap bottle for you. The pre-scrub is done during the first surgical scrub at the Next is cleaning the nails. Use a pick to clean the nails and remove any dirt to prevent contaminating the materials. Then dispose it in the sharps container. Next we'll do is scrubbing with a brush. In the surgical hand washing, it is advised to use a brush with soap. Use a sterile brush, then use the bristles to scrub the nails of both hands. Then use the sponge side to scrub the palm of the hands, followed by the dorsal, then the lateral aspects, then the thumb and the interdigital spaces. Then scrub the wrist and the forearm. Then we rinse it. Next is the final scrub. We won't be using the scrub brush, but instead we'll be using our hands. We'll use an antimicrobial hand wash on the hands, then start rubbing the hands palm to palm, then the interdigit spaces, then the tips of the finger are rubbed on the palm, then rub the wrist and the forearm and rinse. Turn up the water by using a new paper towel to grasp a hand-operated control or have someone else to do it for you. This will prevent the nurse from picking up microorganisms from the faucet. Raise both hands in the front of you and keep it above your elbow, ensuring that it touches nothing other than the procedure you're going to perform. Now we will continue with the next procedure if it is surgical gloving or gowning. And there is no traditional evaluation of the effectiveness of the individual nurse's hand washing.